Hi there. So, Carl here is going to help me demonstrate some techniques from our head, neck, and jaw workshop. It's a 2-day, 12 credit for New York State and NCB TMB continuing education for massage therapy course, in which you will learn some great and advanced myofascial techniques for helping out and releasing the neck, the head, and the jaw. And counterintuitively, the very first thing I'm going to talk about is when you work on the neck, the very first thing that will help you to do that is to reposition the pelvis and the ribcage so that the neck muscles are actually in a more neutral position and can relax. So I'm just going to check Carl here. I do think he's got a little bit of a posterior tilt here. I can move his hands up there. I'm just going to slide my hand flat under his lumbar and get a sense of his secondary curves. And for him, he's got what we would call a little bit of a military spine, meaning that his lumbar and cervical curves are a little flat when they should have more of a curve. So I'm not going to make any major change here, but I can basically lift up on his lumbar using my forearms and just see if I can encourage a little bit of release in his abs by lightly resting my hand there. Try not to help out and just see. I'm going to lift, kind of rocking his lumbar a little bit just to see if I can get his ASIS bones to fall a little bit away from his ribs. Great. Okay. So just to show you like where he's at right now, his traps aren't super tight, but they're not super soft either. So the next thing we're going to reposition is the angle of the rib cage. For most people in modern life, our rib cages tend to come back a little bit, and so I can slide my hand under his shoulder blade and put my fingertips between his shoulder blade and his spine and just gently lift the top of his rib cage while lightly compressing the bottom. And I'm just giving a space for those bottom cervicals to have a little bit of room to come away from the table. Breathe out. Nice. And I can come around and do that over here. Again, I'm sliding my hand under and between the shoulder blade, using my fingers to gently lift his ribs, and then I can compress a little bit on the lower and just try to see if I can lightly change the angle of his rib cage in relation to the table. Good. And that basically now allows me to get my fingers under here, which I couldn't do before, and have a little bit more of a secondary curve for him. Already that's going to lighten up his traps without really working on them because they are now more slack. They're not overstretched from this position, right, which tends to pull the traps really long, which makes them want to tighten up. And now we've just softened all that and given them some space to relax. The next technique that I want to show is to rock and traction each vertebra away from the one below it. So I'm going to use my fingers like this. I'm going to slide them under, and I'm going to, starting at T1 and C7, just kind of gently rock each vertebra towards me, more at an angle, not straight up and not straight out. So I can start down here and just rock that vertebra towards me. Then I can work up vertebra by vertebra. Vertebra by vertebra. Words is hard. At a certain point, if this doesn't feel right on your fingers, you could switch and do it on the sides of the vertebra. And basically, I'm just trying to rock and traction each one below from the one below it. And again, the goal here is, do I have a good cervical curve? The more I can create a good cervical curve, the more all the muscles in the neck, back, and shoulders go into slack and relax. So the next one is going to be using the fingertips on the transverse processes and rocking the vertebra side to side in relation to the one below it. This is not just therapeutic, it's also a good assessment tool, because you may find that some or more than one or many vertebrae are not that mobile compared to the other ones. And so you can really test and see, are there any specific vertebrae that don't move as well as the other ones around them? And for him, he's starting to relax. We've now done a little bit more of this, so he's got pretty good range of motion here. I can really move his vertebra side to side. He's not really resisting. And we are now starting to really get a nice head bobble. I haven't worked on his suboccipitals at all, but as we're starting to get all the different parts into a neutral position, they actually get to relax. Okay, so the next technique we're going to do is a traps release. Now that we've got all of these traps nice and soft, I'm going to take my soft fist using the edge of my knuckles. For some of you, you might be able to use these, but I find these are the easiest way. I'm going to place them here, and I don't want to be on top of the scalenes. I want to get the edge of the traps, and I'm going to sink down towards his spine gently, and then to increase that, I'm going to have him roll his head to the left. And so he's going to be in charge of how much and how quickly this muscle opens. It's not me trying to make the tissue move. I'm actually just sinking into it, and he's stretching it open, and I'm just following it as it opens. So it's really not taking a lot of muscle strength or a lot of stress on me. And I can really slide all the way under here if he'll let me. Great. No, don't help. Come back, and we'll do the other side. So I'm going to, again, place my knuckles right at the edge of the trap, and I'm working down and have him roll away from that. I'm also keeping all of my joints as aligned as I can with my center, so my wrist doesn't break. I don't have to use forearm muscles as much. My elbow doesn't break. It's just one of the principles of our body mechanics workshop is stacking the joints as much as possible. And so it really doesn't take a lot of force or tension for me. I could really do this all day. Great, come back. And so now we really have some nice softness here. He's got some bobble back in his head. I can go back and double check. How are these doing? And that might be all I really need to do for the posterior of his neck. There's certainly tons more you'll learn in the workshop, but that might be enough for many clients, because I do think if you don't have a lot of time to spend on the neck, you really should spend more time on the anterior. So we're going to go ahead and work on a SCM stretch as our last technique here. But a lot of therapists are really afraid to work in here. It's, there is this delicate trachea and this, danger zone triangle here that we all get worried about. But as long as you know how to access these muscles safely, it's really important to work on them. So with SCM, one of the easiest ways to work on it is to get it to fire so that it's very easy to grab, and to hold it and traction it sideways. So to get it to fire, I'm going to have him lift his head just a millimeter. Yep, there you go. You can see him plain as day. Now I'm going to come right to the inside of the muscle, and I'm going to sink down a tiny bit, but not very far, and then just enough so I can get a good hold, and then I'm going to traction away from the midline. And now he can release his head. Good. And now that's already a little bit of a stretch. To get him to increase it, I want to have him rotate his head, and I want to make a distinction here. This would be rolling. Notice SCM doesn't fire here at all. If he rotates, that will make this pop out and stay tight. And so to get a good stretch on SCM, you want to make the distinction between a fall away roll and a rotation without changing the position of the spine. So go ahead and lift up. All right, great, I've got it. So come back down and rotate slowly to the right. Already I can feel the muscle on my fingers, and all I have to do is hold it here and give him something to stretch against. And then you're in charge of the stretch. However much you turn is however much the muscle will stretch. You get to choose. I don't have to do anything other than sit here and hold it. Great. Come on back. Let's make sure to do both sides. Don't want him just turning his head in one direction all day long. Great. Okay. Go ahead and slowly turn to the left. Sorry, slowly rotate to the left. Now, you won't see this on camera, but I'm using a little bit of an advanced thing right now where my ring finger is on the second head of his SCM muscle. That's definitely something we'll talk about and teach more in the workshop. Come back. All right, so now, now we really have this ability to stretch and open the anterior side of his neck and create a really nice cervical curve. He's got a lot of nice head bobble happening now. Easy motion, right? I can easily, gently rotate his head in a nice figure eight. I don't feel any catch points along that figure eight, so there's nothing like standing out as like really stuck from one point to the other. And I'm just going to be nice and finish up with a little bit of a suboccipital hold here. So if you like these techniques and you really want to learn more of them and also have some instruction on how to make sure that you're doing them in a way that feels good for your own body as a therapist and is safe, definitely check out the link in the description below for our 2-day continuing education head, neck, jaw workshop.